So it's very frightening that the kidney stone also can lead to
Yes.
kidney failure. So can you elaborate more on kidney stones particularly, because this is very common condition to find kidney stones. So can kidney stone lead to renal failure?
Okay, so that's a very good question, because we know that it's one of the minor things. Stones can be removed and kidney should be normal. But what happens is, anybody who's developed stone, first of all, we need to find out why he developed stone. So we need to know what is his water intake. So being everybody is working these days, so they end up reducing on the amount of water intake. That is first thing that has to change. So anybody who's had stone even once in life should take 4 liters, at least 4 liters of fluids per day throughout. So that is very important. Second is your diet change. Like, so much of fast food that we eat has high salt. Then presence of red meat in our daily consumption, presence of high oxalate containing food in our diet, like spinach, or presence of ladyfinger, the seeds of tomato. So these are few things that will predispose you for stones. And so one is water intake, second is presence of dietary factors, and third is if we ignore it and it happens again and again. So first episode of stone may not cause any kidney damage, but repeated episodes, yes, they cause scarring in the kidney, they cause thinning of the cortex, that is one of the area of the kidney which is responsible for kidney function. So if you have repeated stones, you may have that. Another thing with stones is they can cause urine infection, and not just the simple urine infection, complicated ones where the treatment with antibiotics is much longer, hospitalization is much longer. So these are the cases that lead to kidney failure, where we ignore it. So anybody who has stone has to check his kidney function and take all the precautions, otherwise it can cause kidney problems.
So what are the symptoms in the form of, they are not completely related to kidney failure? Like, we know that if there is a feet swelling, there is a face swelling, people know that something wrong, there might be some kidney problem. But what are the other symptoms? As you were talking about the nausea, vomiting, so what are these symptoms?
Yeah, so there are certain subtle signs of kidney failure, one of which is nocturia we talk about, which is getting up at night and passing urines many times. Okay, so this is one of the early symptoms, where interstitial, there are two areas in the kidney, the cortex and the interstitium. So once the interstitium is affected, this is one of the symptoms that we see. In the night time, the patient may get up many times. He may have cramps.
Cramps.
Okay? So just the patient may present with cramps or restless leg, which is like he has the tendency of moving the leg, or leg pains, presence of sleep disturbances, altered sleep pattern, and generalized fatigue. So they may present just with fatigue, and we get to know, okay, fine, the renal function is not. So these are very subtle symptoms. And of course, that uremia I was talking about, where there will be loss of weight, there will be loss of appetite, some nausea, vomiting may be there. So this is one of the subtle symptoms of kidney failure. So even though you may be producing urine, there may be no swelling, but if these symptoms are there, you should check a kidney function test and get to know whether your kidneys are actually doing good or not.